Good morning. I'd like to call to order the meeting of the Minnesota Senate Health and Human Services Finance and Policy Committee. It is Wednesday, March 4th, 2026, and we are going to start. We're waiting for the chief author for the first bill to arrive, and we're going to start with Senator Utke. Has two bills on the agenda, and Senate File 2154 and 2155. Senator Utke, would you like to start with 2154?
Good morning. Thank you, Madam Chair. And yes, I will start with 2154. Madam Chair and members, Senate File 2154 addresses a challenge facing Minnesota's funeral profession: the difficulty of recruiting licensed morticians from other states. Minnesota is one of only 4 states in the country that requires a bachelor's degree to practice mortuary science. Under current law, Minnesota requires out-of-state morticians seeking a reciprocal license to meet that standard of a 4-year degree. Senate File 2154 creates an alternative pathway for these experienced professionals. Rather than eliminating any standards, this bill allows out-of-state morticians to qualify for a reciprocal license by demonstrating work experience and documented completion of embalming, funeral arrangement, and service cases, in addition to passing the required examinations and meeting continuing education requirements. This is a practical solution to help address the workforce needs of Minnesota funeral homes while still maintaining strong consumer protection. And Madam Chair, I have 2 testifiers with us today, and I'd like to have them add some additional information to the bill.
Thank you. And if you can please state your name for the record, and you can begin.
Thank you, Madam Chair and members of the committee. My name is Jordan McCreevy Seitz, and I'm the president of the Minnesota Funeral Directors Association, which represents more than 650 licensed funeral directors and over 250 licensed funeral establishments. I'm vice president with my family firm, Washburn McCreevy Funeral Chapels, which has 16 locations here in the Twin Cities metro area. We want to thank Senator Utke for his work on Senate File 2154. Minnesota's funeral profession, like so many other professions, is facing a workforce challenge. Funeral homes across the state are struggling to recruit licensed morticians. As we seek to attract funeral directors from other states, our reciprocal licensing requirements present a significant barrier. Minnesota is one of only 4 states in the country that requires a bachelor's degree to practice mortuary science. An out-of-state mortician seeking a reciprocal license must also meet this requirement. The result is that experienced licensed morticians from nearly every other state are effectively shut out of practicing in Minnesota. Senate File 2154 addresses this by creating an alternative pathway within the reciprocal licensing process. Specifically, the bill allows an out-of-state mortician to qualify by demonstrating at least 3 years of practice in another jurisdiction and documented completion of at least 25 embalming cases, 25 arrangements, and 25 services. The applicant must also pass the required examinations, complete continuing education, and submit an affidavit confirming they are not subject to any pending investigations or practicing under a restricted license in another state. This is not a shortcut. The bill maintains strong standards and consumer protections. It simply recognizes that years of hands-on experience in another state should count for something when we are asking qualified professionals to come practice in Minnesota. MFDA believes this bill strikes the right balance between maintaining high standards and addressing the workforce needs of our profession. Again, we want to thank Senator Utke for leading on this issue and the committee for your time and consideration. Thank you, and I'm available for any questions.
Thank you. And if you could state your name for the record and begin.
Absolutely. Well, thank you, Madam Chairperson Wiklund, as well as all the other members of the committee for allowing me to testify here today. My name is Jay Dietz. I am the Vice President of Funeral Practice and Experience for Virton. Virton is the state's largest provider of funeral services. So today I'm here to represent our 42 facilities and touches 38 communities throughout Minnesota. Verton hired a real-time talent, a St. Paul organization, to try and quantify the issue for us as we try to solve the workforce problem. And I'd like to share some of the data points of that workforce study with all of you here today. Minnesota currently only has 51 licensed funeral directors for every 100 open positions. So in our current state, we're already at half staffing as a profession. To make that situation more challenging, 54% of licensed morticians in Minnesota are age 55 and older. To make that even worse, 1 out of 3 current licensed funeral directors in the state of Minnesota are 65 and older. We have a major retirement issue that's pending. It is estimated in the workforce study that by 2029, 50% of the current workforce is projected to be gone. That equates to Minnesota needing 552 additional morticians by the year 2029 in order to adequately meet our demand. In 2023 alone, there was a turnover rate of licensed funeral directors in Minnesota of 33% and only a 10.9% replacement rate. We hemorrhaged 22.1% of our workforce in 2023 alone. The University of Minnesota, our primary source of licensed funeral director applicants in Minnesota, averages 35 licensure qualified students per year that graduate. It's also it becomes obvious that under Minnesota's current law, we cannot solve our own problem internally, and we need assistance from other states. The good news, Minnesota compensation is 40% higher than the national average. So there's many funeral directors that would like to come to work in Minnesota. Our organization is slightly unique because we have a talent acquisition team that is constantly recruiting for us. The problem is many people run into the bachelor's degree requirement and filtered out of the system. We have a single program for traveling funeral directors, and some of the data points just from 2025, we had 60 applicants interested in working in our traveling funeral director team, but 40% of those applicants were filtered out because of the educational requirement. That's 24 likely employees for licensed funeral directors that were eliminated in 2025 alone, just with our organization. That equates to the same number of total funeral directors we hired in Minnesota. It would have doubled our efforts. The other concerning piece is this is going to have a disproportionate impact on rural Minnesota. The metro area still has better opportunity of hiring because more young people want to live in the metro area. What's happening in outstate is that our funeral homes are already short-staffed and oftentimes only by the operating funeral director. And when that funeral director retires, sometimes passes away, there's no one to replace them, and that community then loses the ability to have local funeral service available to its residents. This is a Minnesota issue, and we can't solve it on our own. So we are here to ask for your support with 2154. It's truly a bipartisan bill, a bipartisan issue. Funeral service touches the lives of every Minnesotan at some point, and we need your assistance with this bill. Thank you.
Thank you very much for the testimony. Members, do you have any questions about the bill? No questions. It does seem like you have a lot of data to tell you how many people you are going to need, and you do need to find some other ways to be able to bring more people in. And I'm assuming that because this test that is required then is taken all over the U.S., I mean, and so you feel that that's representative then when those people come here, they have the foundation of what they need, and then along with the work and the documentation that they can submit. I don't know if you have any more comments about that, about how the preparation of funeral directors in other parts of the country. Mr. Dietz.
Yeah, Madam Chairperson and committee members, The national standard would be an associate degree that would include the completion of an accredited mortuary school program. That has proven to be an adequate education level with the rest of the nation. There was only one state that had a lower requirement, and that's Colorado. But Colorado has identified the fact that that created issues, and they are increasing their requirements currently. So it is the national standard, and it is believed to be more than adequate, assuming they've completed an accredited mortuary program. They also have to pass a national board exam. That is an exam that's acknowledged by every state as a good measure of their educational standards. And then additionally, each state has its own licensing requirements. So there's a state exam that has to be cleared so that they know the current state requirements in each state that they would apply for licensure as well.
Thank you. Seeing no other questions, I appreciate your bringing this bill forward. Senator Utke, we're going to lay this bill over and then actually with all of these professional licensure and scope type bills, we're going to lay over as we decide how to move them forward, if they're going to go individually or if we're going to put them together. So Senate File 2154 is laid over. And now we'll move to Senate File 2155. Senator Utke.
Thank you, Madam Chair. And we will continue on with the same theme of helping out our funeral homes. So Senate File 2155 modernizes the internship requirements for individuals pursuing a license to practice mortuary science in Minnesota. Under current law, a person must complete their education before they can begin a registered internship. This bill changes that by allowing students who are enrolled in an accredited mortuary science program to begin their internship while they are still in school. The bill also provides for an alternative supervising license so that interns' training is not interrupted in their primary supervisors. Let me rephrase that or redo it because I messed it up. The bill also provides an alternative supervising license so that an intern's training is not interrupted if their primary supervisor is unavailable. This is about getting people into the profession sooner and giving them hands-on experience earlier while maintaining appropriate supervision and standards. Again, Madam Chair, I have two testifiers here to give us the additional data along this line of internships. So, thank you.
Thank you. And Mr. McCreevy Seitz, if you'd like to go, and please state your name again for the record.
Thank you, Madam Chair and members of the committee. My name is Jordan McCreevy Seitz, and I'm the president of the Minnesota Funeral Directors Association, which represents more than 650 licensed funeral directors and over 250 licensed establishments. I'm VP with my family, Washburn McCreevy Funeral Chapels, with 16 locations here in the Twin Cities Metro. We want to thank Senator Utke for his work on Senate File 2155. Senate File 2155 addresses the pathway for individuals seeking to enter funeral profession in Minnesota by modernizing our internship requirements. Under current law, a person pursuing a mortician's license must complete their accredited mortuary science program before they can begin their registered internship. That means a student who has spent years in school studying mortuary science cannot begin working toward completion of their required 2,080 hours hands-on internship until after they have graduated. Senate File 2155 changes this in several important ways. First, it allows students who are currently enrolled in an accredited mortuary science program to begin their registered internship while still in school. This gives the student opportunity to apply what they are learning in real time under the supervision of a licensed mortician. Second, the bill provides an alternate supervising licensee. Under current law, an intern can only be supervised by a single licensee. This bill allows for an alternate supervisor so that an intern's training is not disrupted when their primary supervisor is unavailable. And third, the bill includes an important safeguard An intern who has not yet completed coursework in embalming and restorative arts must be in the physical presence of their supervising licensee in order to perform surgical procedures and embalming. This ensures public safety while still allowing students to gain experience in other aspects of funeral service. These changes will allow mortuary science students the opportunity to gain hands-on experience earlier while maintaining appropriate oversight and standards. Again, we want to thank Senator Utke for leading on this issue and the committee for your time and consideration. Thank you. I'm available for any questions.
Thank you. And Mr. Dietz, if you could please state your name for the record and begin.
Yeah, thank you, Madam Chairperson Wiklund, along with all the members of the committee once again. My name is Jay Dietz. I'm Vice President of Funeral Practice and Experience with Virton. We are the state's largest provider of funeral services, and today I represent our 42 facilities across 38 Minnesota communities. I will share some additional statistics. Virton hired real-time talent, a St. Paul, Minnesota organization, to quantify the workforce problem in funeral service, and we looked at state and national data. The Bill 2155 is really all about retention. As mentioned previously on our workforce study, in 2023, 33% turnover rate in licensed funeral directors in the state of Minnesota, with only a 10.9% replacement rate. So in 1 year alone, we lost 22.1% of our workforce. The University of Minnesota graduates 35 licensure qualified students per year. An unfortunate data point for the University of Minnesota and nationally is that only about half of those graduates remain in funeral service longer than 5 years. So we have a pretty significant retention issue in the profession of funeral service. And the obvious question is, why is the retention rate so low for mortuary science graduates? Funeral service has changed dramatically over the years. This used to be a family business, and it was generational. And it stayed within families primarily for decades. Now, the majority of mortuary schools are first-generation students, like myself. They don't come from a funeral family. And the problem with that is they also don't fully understand what a life in funeral service involves. They didn't grow up around it. They didn't watch their parents miss birthdays and holidays and be out all night. So their awareness of what the industry truly is lacking. Now, I think that's a significant piece of the fact that we are not retaining people. Once they get into the profession, we hear this directly from new hires, that this is not what I thought it was. What we're asking for in Minnesota is that we get the opportunity for them to see the realities of this profession before they have completed a 4-year program, made the investment in the school, and then are finally allowed with an internship to start to access the back room of the funeral home. And then that's currently the state that we live in. Our neighboring states in Wisconsin, North Dakota, and South Dakota all allow for some or all of the internship to occur concurrently with mortuary school, and in some cases they can actually complete half of their internship prior to enrolling in a mortuary school program to give them that real-world exposure to what funeral service truly is. Iowa is slightly different. It's similar to Minnesota, where internship cannot start until they have completed a mortuary program. However, in Iowa, once you become a mortuary student in an accredited program, you get what they call a clinical card, and then you have access during that schooling to be in an embalming room in a funeral home. So they do get earlier exposure to that opportunity and more awareness. So we're asking for your support of Bill 2155 that would allow the changes explained by Mr. McGreevy-Seitz to allow concurrent internship with schooling to get this exposure earlier, make sure this is the right field for them, and then also expedite their licensing process once they have completed the schooling. We truly believe this will improve retention, and additionally, it will strengthen the long-term workforce pipeline for funeral service, given that we have more clarity with the people that are in the field. So we would like to see that 5-year 50% loss go away and see more people stay in a field that they feel called to. So I want to thank Senator Utke for his work on this bill, and thank you for the time here today.
Thank you very much. Members, any questions about this bill? No questions. Well, it seems like it will be a good opportunity to encourage more. Do you know, has the university, do they need to adapt their program at all if you are allowing this, or have they indicated whether they would be kind of supportive of working together to implement this? Mr. Dietz.
Yeah, Madam Chair Wiklund and committee members. I actually last week had a nice conversation with Michael LeBrant. He's the director of the University of Minnesota's Mortuary Science program, and we addressed this particular bill, and he is in support of this bill. It does not impact what the program at the University of Minnesota is trying to accomplish with their bachelor's degree and their 4-year program. So he is in support of this bill.
Great. And I don't see any other questions. So this one we will also lay over for possible consideration in the future. Any final thoughts, Senator Utke?
Thank you, Madam Chair. No, these guys did a wonderful job of informing us of what both of the bills do and how they're a much needed change for their professions. So I thank you for hearing the bill, and thanks to you and the members for listening. So thank you.
Thank you. And so Senate File 2155 is laid over. And now we will, I think I saw Senator Mohamed is here, and we will go to Senate File 3682.
Thank you. Nice to meet you.
Welcome to the committee, Senator Mohamed, and you can begin. Members, just for your reference, and I should have pointed this out earlier, but for the bills that relate to professional licensing and scope of practice and that titles, things like that, we do ask people to fill out the questionnaire, and you have a copy of the questionnaire in your packet that was filled out for each of these bills. So. Senator Mohamed.
Thank you, Madam Chair, and members of the committee for the opportunity to present this legislation, which makes a simple change in how words are used that would make a big difference in how Minnesotans access the care that they need. Minnesota's 18,000 licensed social workers provide essential care from children and teens in school through adulthood and increasingly serving our aging population. This legislation gives that service the importance it deserves. Senate File 3682 will codify in state law that counties can only use the title social work to describe someone with a social work degree or a license to practice. Under current law, the intermixing of titles or descriptions can mislead the recipients of care into the belief that an employee has more experience or qualification than they actually do. I want to be clear that this legislation wouldn't have a negative effect on county employees currently employed. This isn't about anyone losing their job. It's about Minnesotans gaining clarity and certainty in their care. This legislation has the support of major social work organizations in Minnesota, including the state chapter of the National Associations of Social Work, the Minnesota School Social Work Association, the Minnesota Nursing Home Social Workers Association, the Minnesota Association of Black Social Workers, and the Minnesota Hmong Social Workers Coalition. Making this change would bring this industry in line with others that provide essential and unique professional services. Minnesota law doesn't allow people to call themselves a medical doctor or represent themselves as an attorney. We should have the same standard and same protections for social workers whose work is no less important. And with that, I think we have testifiers, and then I'll take questions.
Thank you. And first, I have Dr. Karen Goodenough and Elizabeth Partington. If you could come forward.
Good morning.
Welcome to the committee, and if you can
Thank you.
please state your name for the record, and you can begin.
Great. Good morning, Madam Chair and Committee. My name is Dr. Karen Goodenough. I hold a bachelor's, master's, and PhD, all in social work, all from Minnesota schools. I am Executive Director of the National Association of Social Workers Minnesota chapter, and I chair our National Licensure Task Force. I'm a known national expert on social work licensure, and I support Senate File 3682. I regularly take calls from frustrated members of the public who are upset about their county, quote, social worker. My first question is often, are they actually trained as a social worker? In Minnesota, social work is a licensed profession governed by Chapter 148E. We have clear education, training, supervision, and ethical standards that apply everywhere except in our counties. While we have had licensure and title protection for nearly 40 years in Minnesota, we have a critical gap that we need to fix. Counties are currently permitted to assign the professional title of social worker to employees who do not hold a social work degree. Individuals without social work degrees may be skilled and dedicated public servants with backgrounds in psychology, criminal justice, history, accounting, all sorts of things, and counties should absolutely hire these interdisciplinary teams. However, the professional title of social worker should and must mean something. The title social worker signifies a rigorous, standardized education. It requires graduation from an accredited program and mastery of core competencies ranging from ethical practice to crisis intervention. It includes 400 to 900 hours of supervised field internship and a commitment to a code of ethics. In every other setting in Minnesota, in our hospitals, our nonprofits, and our schools, this specialized preparation is the mandatory standard. Only in our counties is the standard waived. I want to be clear again about what this bill does and does not do. It ensures transparency by aligning the social worker title with the educational standards required in all other professional settings. It does not tell counties who they can hire or eliminate interdisciplinary practice. It does not take jobs away from current employees, and it does not change the licensure exemption. This proposal includes a clear exemption for anyone currently employed by a county. We are looking forward, ensuring that the next generation of practitioners meets the same standards as their peers in other sectors. This is about transparency and consumer protection. If you went to a county hospital and were told that your doctor or nurse didn't need to meet the education standards because they worked for the government, you would not accept that. Minnesotans deserve the same clarity in social services. This is also about equity. Social work is a 125-year-old profession, historically dominated by women and often undervalued. Title protection reinforces professional standards and supports fair recognition and expertise. If someone uses the professional title of social worker, it should accurately reflect the education and preparation that title represents. Minnesotans deserve to know who's providing their services, counties deserve flexibility in hiring, and our profession deserves the integrity everywhere in this state with their title. I urge your support for Senate File 3682. Thank you for your time and consideration.
Thank you. Ms. Partington, if you could please state your name for the record, and you can begin.
Yeah, good morning, Chair Wiklund and members of the Health and Human Services Committee. My name is Elizabeth Partington. I am here with my spouse today in support of Senate File 3682. We are former foster parents who retired our license because we felt that the county had misled us by using the title social worker for several county workers who may not have met the qualifications of that title. When we first entered the foster care system with the goal of providing a safe and nurturing home for children in need, our expectations of the county social workers were rooted in the well-established definitions of social work and its code of ethics. For 2 months, we had the great joy of getting to know baby M and her birth family. As brand new foster parents dealing with a unique situation, she was an emergency placement with a complex story, we reached out to her social worker several times seeking the services defined in Section 148E. However, after some initial positive interactions, the worker's tone shifted and our requests were met with increasing hostility and confusing or conflicting responses. Then baby M spent 2 weeks in the hospital. Much to our confusion, her social worker drastically increased visitation with her birth family to several hours daily without county supervision, despite the court agreement for 1 hour, once weekly supervised visits. And at the end of her hospital stay, we were devastated to learn that baby M had sustained a rib fracture. We reached out once again to the social worker, hoping to find out how we could participate in the county's investigation into this injury and how to help center baby M's emotional and physical well-being. We were met with more hostility. The worker informed us that baby M was immediately removed from our care and hung up the phone on us as we asked whether we could say goodbye. This worker then encouraged police to investigate me, only me, and not any of the countless people who had handled baby M during her hospital stay, even showing up at my police interview to make accusations against my character. Weeks later, the police determined that I had had no part in our foster baby's injuries, but the damage was done. Baby M endured the trauma of moving to a third home at only 2 months old, halting planned reunification with her sister, and having no answers for her injuries. Because we felt that baby M's assigned social worker had acted unethically and caused unnecessary harm, we decided to report her to the Social Work Licensing Board. This is how we learned that she did not have a social work license with the state of Minnesota. In fact, not a single title social worker we had worked with at the county was licensed, and may have had no social work education at all. We were shocked and deeply troubled. These workers held a title that carries important expectations, but they were not bound to the standards of that title. The county had lied to us with expectations of social work and left us with none of the assurances that accompany that title. This brings me to the opportunity that lies before you with the bill SF 3682. By supporting this bill, you have the power to offer current and future foster parents transparency. You can ensure that those who use the title of social worker are held to the rigorous standards that the title implies, giving all those who work with the county a clear understanding of the roles of their support teams. Thank you.
Thank you for your testimony. We do have 2 testifiers now on Zoom, and first I'll go to Nicole Helget, or Helge. I'm sorry if I'm mispronouncing it. If you could please state your name for the record and begin your testimony.
Good morning. Thank you, Senator Mohamed. Good morning, members. My name is Nicole Helget, and I'm a county commissioner in Nicollet County, Minnesota. Our county only employs licensed social workers. I'm here today to speak about the essential role these licensed social workers play in sustaining rural Minnesota communities as core public infrastructure, and in support of Senate File 3682 to clarify and protect the language used to describe the roles of licensed social workers in our communities. SF 3682 addresses a critical issue in our state, the protection and clarity of professional social work titles. At its core, this bill strengthens the integrity of Minnesota's social work licensing framework by refining and reinforcing who may legally use protected professional titles. In rural communities across our state, licensed social workers are often the most accessible mental health professionals available. In communities where psychiatrists and psychologists may be hours away or entirely unavailable, social workers are clinicians conducting diagnostic assessments, providing trauma-informed therapy, managing suicide risk, and stabilizing families. When a farmer is facing foreclosure, when a teenager discloses dating violence, when a child reports abuse, when a family cannot secure housing. In rural Minnesota, a licensed social worker is frequently the first and sometimes only professional responding. In rural areas, service systems are thinner, wait lists are longer, transportation barriers are real, confidentiality is more complex in communities where everyone knows one another. And yet the needs are not smaller. They are magnified by isolation and limited access. Licensed social workers in rural communities perform multiple roles simultaneously. They provide clinical mental health services. They coordinate access to housing, food, and medical care. They conduct child protection assessments. They respond to domestic violence situations. They collaborate with schools, law enforcement, and public health. In Nicollet County, we regulate the language used to describe and define these professions, not to create barriers, but to protect the public. When a professional title, such as social worker or independent clinical social worker, is used, the public assumes that individual has met rigorous education, examination, supervision, and ethical standards. That assumption must be accurate. especially as our state continues to experience unprecedented scrutiny. SF 3682 is about precision in law, transparency in practice, and protection for the public. When Minnesotans seek help, they deserve confidence that the professional standing before them has met the standards our state requires. This bill affirms that commitment. For the integrity of the profession, for the safety of our communities, and for the clarity of our regulatory framework, I respectfully urge your support of Senate File 3682. Thank you.
Thank you very much for your testimony. And also on Zoom, our last testifier, I have Idil Abdul. And Ms.
Yes.
Abdul, if you could state your name for the record and begin.
Good morning, Madam Chair, dear Madam Chair and members. Many thanks for the opportunity to be able to testify today. My name is Idil Abdul. I'm an autism mom and retired advocate. I testified regarding this bill and ask that no social worker without the education and licensure call themselves a social worker. As an autism mom, I have encountered many county staff who work in counties, and when someone says that they're a social worker, you assume they have earned that title, have the education and the required licensure. Anything less is not accurate and should not be allowed. In fact, many counties hire employees or external contractors without the proper education and experience to support individuals with autism, including social workers, behavior therapists, etc. I ask that the standards are higher for people who are hired to work with children like mine and other individuals with autism. As legislators, you are obligated to ensure that people who have access to our children do have the correct licensure, they have the education, they have the experience, so that in Minnesota, we're not always reactive, but rather proactive to issues before they do encounter. Thank you so much for your time.
Thank you very much. Members, do you have questions? Senator Cran.
Thank you, Madam Chair, and Senator Mohamed. Walking through, I understand the social work title, but in the description, it says, well, grandfather in, right? Those that are all in place today. And I think we, in the various venues for which people operate schools and our clinical environments relative to county social work, which is a pretty broad category. Some of those, I believe, are doing casework and benefits, enrollment, and all those things. How will you delineate between an unlicensed, well, two questions, well, we get a couple questions. So those that are, quote, unlicensed, that will remain, that are grandfathered in, what title will they carry, and how will that affect, or what anticipated changes in the job classifications, which will be a result of that? Because if you're not, you didn't, nobody said it, but that's what's going to happen. So I want to know, what does that look like?
Senator Mohamed.
Madam Chair, thank you, Senator Curran, for that question. I think, first of all, in terms of what they will be called, that's up to the county. They can be called a caseworker, but we want to make sure the folks who actually are licensed are the ones who have that title. Whether it will change their classification, it will not change. This policy doesn't intend to change people's pay or job classification. Often these folks who work in the county are also unionized, and so it's up to their bargaining union to figure out what that looks like.
Madam Chair.
Senator Curran.
Senator Mohamed, and so, so those, it's pretty broad. It says the counties get everybody's grandfathered in. So is what you said. And so we'll have current people who are performing social work or social worker activities who are going to be grandfathered in. Are they going to maintain that same title moving forward?
Senator Mohamed.
Madam Chair, Senator Curran, yes. But it's also important to note that it does not require current employees to go change their license and go get a license. Anybody who right now works as a social worker in the county will be grandfathered into the system. And then anybody new who the county is going to hire, we want them to actually have a difference between whether they're an actual social worker or not. Going forward, if counties want to change those other folks' titles, that's up to them, but they're union, and so we know that their union folks are going to be at the table.
Madam Chair.
Senator Curran.
And Senator Mohamed, so day forward then, So anybody who is unlicensed, who doesn't meet the criteria, can carry the social worker category. That the company or the counties have the ability to classify them whatever, likely caseworkers or whatever. But at the same time, you'll have a whole host of unlicensed people carrying the title. And the only delineation and benefit is you'll want a higher likely reclassification or review of those currently or those that will carry the social worker title day forward. And so when that occurs, will those people that are grandfathered in be included in that likely study? Because we see, I've got your little slip here. I've got one of them from the office. And to solve the gender, the pay gap and those things, you'll be seeking a higher classification and maybe delineation of roles between the two, which are caseworker versus something clinical. I'm not sure we have enough, I'm not sure they'll have staff to do that, but will somebody that's grandfathered in, when you do a job classification change, are they going to get that same status if they're unlicensed day forward?
Senator Cran.
Dr. Goodenough, please state your name again for the record, please.
Thank you, Madam Chair. Dr. Goodenough, NASW, Minnesota. Senator Cran, I want to clarify a couple things. We're talking about two separate exemptions currently that exist in the counties in Minnesota. There's a title protection exemption and a licensing exemption. We are not at this time bringing forward any change to the licensing exemption. That has been brought to the legislature several times and has not gone through. So we are trying to fix just the titles at this point. So going forward, what will happen is, and let me say also that the grandfathering in, blanketing in clause, allowing anyone who currently has the title of social worker in a county, being able to keep that, was something that we negotiated with the unions so that we could make this thing happen, because they agree with it, but they didn't love people losing their current titles in the mix of it. So anyone who currently has the title of social worker will get to keep the title. They are not required to be licensed in our state. That is a completely separate statute. And then some counties, as some are choosing right now, will choose to retitle all of their people. And this will give them some time to do that work. And what we want to ensure is that going forward, if they choose to give anyone the title social worker, that they have actual training as a social worker.
Madam Chair.
Senator
Testify. I'm sorry, I don't know your name because we're not provided those. So, right, but the natural court, you clearly stated what I was trying to get at. For now, right, you're requiring licensing for those that carry the title. So
no,
Dr. Goodenough.
Sorry.
Senator Cran, did you want to finish your question? Or
yeah, as it's described, you will day forward require licensing for those that carry the title social worker. Right, they'll have the education requirement. Whether you officially license them or not, you'll have to have the education requirement, whether you formally license them. So it really doesn't change anything. But you will then go through a complete class a review. I don't know, it used to be the Hayes study. I don't know what they're called today. And then the caseworkers you have to go through a complete redelineation of roles and responsibilities. Caseworkers will be limited to non-clinical type activities, I assume, and you'll seek higher pay because that's the only reason people are here. That's the only reason this would be brought forward and to delineate them. But this goes contrary to even Governor Walz's elimination of, 4-year degrees and those types of requirements for 75% of state jobs today. And so I just don't see, in many cases, where that, unless you have delineation responsibilities, that you're doing purely clinical activities, and that's what will have to happen and through all the counties, is to go through and make sure that those that require that higher level of education are in the clinical side, and all the operational casework or the other 3 or 4 different categories then are classified appropriately. They will not want less pay for the work that they're doing because many of them are doing all of it today. And so the only goal is raise the pay for those that you're going to force license or force an education requirement, which hopefully provides a higher level of service. But across the board, we haven't seen that in the private sector. They're moving away from those things, and people are growing those skill sets in-house. So I would hope as you move forward, those that you're going to grandfather in today that are doing the very work that you're going to require them to have an education going forward, get that same benefit as they move through a reclassification and the appropriate channel and not be abandoned after the fact. So thank you, Madam Chair, and thank you for the testifiers.
Senator Mohamed or Dr. Goodenough, did you wish to add any more? Okay. Senator Senator Abler.
Well, thank you. Appreciate the discussion. And actually, I think the bill's a good idea. We protect the title nurse. We don't protect the title counselor. We don't protect the title massage. We protect the title physician. And so people have certain expectations. When the nurse conversation came up, people would be a high school senior. Hey, talk to my nurse. You know, and so people would presume there was certain expertise. And I think that the testimony about, well, tragically testimony about this rib and all that, and people presume upon a title. And I hadn't thought about this at all till the bill came forward, and I think it makes some sense. I think the compromise in here, I respect the county employees who like their title, but it's going to give you just a really odd hybrid time. And so it's nice to be called something that you're really not trained in. So a person can come on the job day one and be called, and they graduate from Anoka, the largest district in the state, and then they get a great job at the county, and then they're going to be a social worker. And people presume that they're going to understand child protection and all the elements that go there. This has been a problem going in the whole child protection thing, who's going to screen somebody in and all that. And I don't intend to go on very long about that, but this is going to move in the right direction. So in about 20 years, it's going to be clear, based upon your bill, that everybody who has that title is actually credentialed. I don't think it's about pay, but I think it's about informed consent of the people who are doing the work. In that, I support the bill, but again, it's like in 20 years, you're going to have clarity. And I think it's a world of compromise. But so if somebody, and I'm not trying to mess up with your bill, but so in the case about where the family thought they were talking to a trained social worker, and in time you learn. So I mean, a lot of these people that have the title are all right, but in terms of what they've learned. But so what's the recourse if they do something bad? All they can do is get fired. They can't lose a license because they don't have one. Anyway, so that's just my thoughts. I don't understand the timing here. On line 1.17 is 2027, but it's on 2026 on line 1.13. And that's goofy to me, frankly, and maybe you can explain it. So what this means is, beginning July 2026, you can't use those words unless they are hired in the next year, which case they still can. So I'm not sure if that's consistent, and you can just look at it and make sure it's what you mean. I think you just want to, it just doesn't seem correct to me. So I don't know if you want to comment or work on it offline, but thanks. Thank you.
Either Senator Mohamed or Dr. Goodenough, did you want to comment on the timeline or the
Yeah, I think the dates is something we're working through with the social workers, so we'll have consistency before the bill is fully
So I
done.
support the bill.
Yeah.
And and I don't want to step on the county employees, but I think at some point there has to be reasonability, sorry, Madam Chair, about what title and what the implication is and what the duties are. And I think it's actually incumbent on the counties. I guess there's opposition, but nobody's saying anything, which is novel to me. But I think it's incumbent on the counties when they hold a person out to have a responsibility and expertise that's available. And I think, frankly, the county should be liable for misrepresenting the skills of a worker, not the worker themselves and not the bargaining unit, but the county themselves, who says, no, here's our social work cadre, and not one of them's licensed. So anyway, thank you.
Okay. Thank you. Senator Bolden.
Thank you, Madam Chair. Thank you, Senator Mohamed, for bringing this bill. It makes sense to me as someone who holds a license and a title and works in a multidisciplinary team. I understand the importance of transparency and just clarity around roles. And so also never want to pass up an opportunity to thank social workers and uplift the critically important work that they do. It is important now more than ever. And important for the public, for Minnesotans, for community, to just be clear and for everyone to be on the same page of who is doing what work and who is in what role. And that's not to say, as you have said, I appreciate the discussions and the compromise and the work that you have done with the counties, because that's not to say that the work that folks at the county who are not a social worker but currently in that title and doing also really important work, not to downplay the work that they are doing. And it is important to have that clarity of really what is the role, what is the title, what is the background, experience, education, so everybody can be just on the same page and have that clarity. And so appreciate the work that has gone into this. It makes good sense to me. Thank you.
Thank you. Senator Kupec.
Thank you, Madam Chair. Just a couple of comments, because weirdly, this sort of relates to the field that I came out of meteorology. We had a big discussion within our field about who gets to call themselves a meteorologist when you're on television. There is a value to your education. And yes, anybody can go out and go, hey, it's gonna be a nice sunny day today. But there are those times when, when the snowstorm is coming and when the tornadoes are coming, that there's a differentiation between, and I can tell when I watch somebody if they know what they're talking about and when they're not. And now we're talking about much more about people's lives here, and not to say that there aren't county workers out there who are doing a great job, but there is a value in the education that social workers have obtained and the degrees they have obtained. And when situations become more complicated, that's when you need to have those people with degrees and make sure that the public has an awareness. Like I might be very good at cracking people's backs, but I'm not going to call myself a chiropractor because that's you went to school for that and you know what you're doing. And I would expect that if I went to a chiropractor, they're licensed and they're not just smoking like, hey, I'm really good at cracking backs. Welcome to my practice. There's a reason you get to hang that shingle up and call yourself what you are. And so the same thing has applied. So I'm very happy to be on this bill. And I thank social workers for the work and a recognition of the time and education you have put in to get to where you are.
Thank you.
Thank you. Senator Utke.
Thank you, Madam Chair. Just for a little clarity, I fully understand what you're doing here. We've had many conversations over the years, or I've had many conversations with social workers, and it has been a title that a lot of people have used and not all have attained. So fully understand, but how will this affect our counties? Are our counties mandated to have so many social workers on staff or a social worker on staff? Will it change anything with their counties other than if they want to have a social worker going forward, it's going to have to be someone who's attained the level of education required and licensed?
Senator Mohamed.
Madam Chair, Senator Utke, no, counties are not mandated to have a certain amount of social workers. They sort of hire based on their needs and based on their caseload. So right now, there isn't any mandate on them.
Senator Utke. Okay. Senator Liskey.
Thank you, Madam Chair. Madam Chair, Senator Mohamed, I appreciate the bill and the fact that as my good friend over there, Senator Kupec, pointed out, titles are important and how we describe our professions are very important. I'm reading through the bill, and at the very end, in the last paragraph, we have on lines 2.22 and 2.23, it comes to, unless that individual is employed by a county and meets the requirements. Basically, it's saying that they can't call themselves a social worker unless they are employed by a county. And so I guess for me, clarifying that language might be important. I don't know that that was intended maybe that way, but I want you guys to be aware that that's what that statute is going to do if we do that. So just wanted to bring that up.
Thank you, Senator Liskey. I think is the use of titles, it's, the county distinction is already in there, and so I think this is saying that it would add, add a need to meet the requirements of this new section, or this new language in subdivision 4A. Is that, Ms. Heichel, if you could comment on that?
Oh, could you repeat the question, please?
Senator Liskey was asking about or talking about the lines 2.22 and 2.23, and whether that is grouping more people in than it should. And I was just saying, I think that the county, or if the individual is employed by a county, they will now have this new language that they have to comply with. Can you describe that a little further?
Madam Chair and Senator Liskey, I believe that is correct. That is existing language about being employed by the county, and then the new requirements are provided in Section 1 of the bill.
Does that make sense, Senator Liskey?
Madam Chair, thanks. Yeah, it makes sense. My concern is that as a profession, you guys want to have the ability to say you're a social worker, whether you're currently employed by the county or not. So it's just something that I think should be drawn to the attention, because it's in statute maybe already, but it's something that you guys should be aware of as you're proceeding, trying to protect your title. I know that I wouldn't want to have to work for a county in order to call myself a chiropractor. That wouldn't be a good thing. So at the end of the day, that's, I guess, what I'm trying to draw to your attention. Thanks.
Thank you. Yeah, well, you can take a look at that. Any other questions or comments? I don't hear any. Any final comments, Senator Mohamed?
Nope, that's all. The only thing I would add is that currently there are 4 counties that have this sort of law, and those are Cook County, Nicollet County, Lake, and Kindeohi. So we know that other counties are already doing this, so we want to make sure we do it statewide.
Thank you, and I really appreciate your bringing it forward. I appreciate the support of the social workers, and it does seem like something that we should work to resolve, and I appreciate your bringing forward a compromise that accomplishes your goals, and that we can have this discussion today. We will be laying this bill over, and again, thank you for the social workers who have come today on your day on the Hill, and I appreciate your work. It is so vitally important in so many settings in our lives today, schools, counties, and many other places. So thank you for your work. And with that, Senate File 3682 is laid over. And next we will go to Senator Kupec, Senate File 1084. Senator Kupec.
Great. Thank you, Madam Chair. Thank you, fellow committee members. I have Senate File 1084. This makes a simple but significant change to the PA profession. This bill would change the title from physician assistant to physician associate. That's all it does. It is not a change of scope or practice for PAs in Minnesota. The PA scope of practice is already established in current statute and is not attached to the physician scope. So by changing the title, there is no impact to scope. I think a lot of us who, I know I have a PA that is, and I just refer to them as doctor. I think when I go in, there's not a delineation there for me. And I think this is a recognition of the fact that a lot of people, I think, see that physician assistant and think that somehow they're just an assistant to a doctor, when in fact they are much more of a professional. And so associate would just kind of list that up. So the title physician associate clears that about who PAs are, evidence-proven, trusted, rigorously educated, and trained healthcare professionals who increase access to care and improve quality outcomes for the patients of Minnesota and beyond. So I want to also thank my co-authors, Senator Boulder, Abler, Utke, and Senator Mann has also joined on to the bill just recently. So we've filled it up with lots of committee members. So thank you for your support too.
Thank you. And we have Leslie Clayton. If you could please state your name for the record and begin.
Thank you, Madam Chair. Thank you, committee members. Thank you, Senator Kupec. My name is Leslie Clayton. I've been a practicing PA for 28 years. In addition to clinical work in family medicine, I'm the program director of PA and APRN services at a major Minnesota health system, and I serve as the current Speaker of the House of Delegates and Vice President of the Board of Directors of the American Academy of Physician Associates, or the AAPA. I'm here representing more than 4,000 PAs in Minnesota to respectfully ask for your support in restoring our professional title from physician assistant to physician associate. The PA profession was founded in 1965 at Duke University by a physician to address a healthcare access shortage. At its inception, the title was physician associate. However, at the time, the profession was new, unregulated, and untested. In the early 1970s, the American Medical Association exerted influence to change the title to assistant. But medicine has changed dramatically since the 1970s, and the PA profession has grown and demonstrated our value to patients. Today, PAs are recognized as highly educated, nationally certified, state-licensed medical professionals who diagnose illness, develop treatment plans, prescribe medications, perform procedures, and manage complex patients across every specialty with high-quality outcomes. This care is provided, as needed, in association with physicians and all members of the healthcare team. Concerns have been raised suggesting that this change will cause confusion, with no evidence to support that opinion. In fact, the evidence shows the opposite. After more than 15 years of debate within the profession itself, in 2018, the AAPA commissioned an international research firm to conduct an independent, comprehensive 2-year study of patients' and employers' perceptions of the title physician assistant. That research identified that the term assistant actually perpetuated misunderstanding about PA education and scope of practice. After those findings, a second phase of research was undertaken involving patients, the general public, and employers, which demonstrated that physician associate more accurately aligned with the level of care PAs provide and reduced confusion. To further add evidence, in 2024, a bipartisan legislative study by the state of New Hampshire on the healthcare workforce specifically reviewed the title of physician assistant versus physician associate. The outcome of that state study summarized that the title physician associate actually clarifies how PAs function in modern healthcare and reduces confusion surrounding PA education, training, and qualifications. Physician associate is now recognized as the official title in the states of Oregon, Maine, and of course New Hampshire as of 2025, with several other states currently hearing title change legislation, including Iowa and Wisconsin. Physician associate emphasizes what has always been true, which is that PAs practice medicine in association with physicians and other members of the healthcare team in a patient-centered format with proven high-quality outcomes that increase access to care. Healthcare is increasingly complex, and we agree that patients deserve clarity about who is providing that care. We have the evidence that restoring our original title of physician associate improves transparency and reduces confusion to better describe how PAs function in healthcare. I respectfully ask for your support, and I thank you for your time and consideration. Thank you, Senator Kupec.
Thank you. Members, any questions about the bill or comments? Senator Bolden.
Thank you, Madam Chair, and thank you, Senator Kupec. I'm happy to be a co-author of this bill. I'm going to just sort of along the same lines of the bill that we just heard previously. Titles matter, and it is important to be clear for the public, for Minnesotans, for patients, for that clarity of who is in what role. And I think, again, as someone who works in multidisciplinary teams, I work with a lot of PAs. And the piece that you shared about this actually clearing up some confusion makes sense to me. That aligns with my experience. I think sometimes when patients hear, physician assistant, they, envision somebody that's just like handing instruments to a physician. That is not what a PA does at all. And so I do think this would add important clarity to the role, which is useful for patients and just for everybody to be on the same page and have that shared understanding. So thank you.
Any other questions, comments? I don't see any more. I appreciate your bringing this forward. As I've learned more, I understand better, what the goal is, and it seems like a reasonable step to take to bring clarity, and so I appreciate your bringing it forward and helping us understand the reasons for your desire to change this. So this will be another bill that we will lay over for future consideration. So Senate File 1084 is laid over.
Thank you.
Thank you. And next, we will go to non-professional licensing bills now. First, we have Senator Mann, Senate File 3783. Senator Mann, when you're ready, please proceed.
Thank you. Thank you, Madam Chair. Senate File 3783 will remove flavoring from the definition of compounding medicine. The science of compounding medicine is very strictly regulated, and Minnesota is one of 5 states that considers flavoring to be equivalent to compounding. This means that many pharmacies do not offer the addition of different flavors to medications, and this is a problem for many children as well as for many adults. Our jobs as the state should be to keep people safe and to trust our licensed professionals to do their jobs. We should remove barriers that keep pharmacists from providing the best care that they can, and as the law stands, they cannot do that. Adding flavor is generally simple. Pharmacists know what they're doing, and there is no data to indicate that flavoring has caused any harm. With that, Madam Chair, I'll pass it on to the testifiers.
Thank you. And first, I have here with us Krista Ullman. Welcome to the committee, and if you could state your name for the record and begin your testimony.
Good morning. Thank you for having me. My name is Krista Ullman, and I am a museum exhibit developer by training, but currently taking a career pause to raise my 3 young children. And I'm here to urge you to support Senate File 3783. I first became aware of this issue last November when my 3-year-old daughter was prescribed amoxicillin for an ear infection. I went to pick up her prescription and asked the pharmacist what flavor options they had available. And this is because when my oldest daughter had an ear infection a few years prior, the pharmacist let her choose between a handful of different flavors, which made giving her the medicine a lot easier. This time, however, the pharmacist told me that amoxicillin now came pre-flavored and bubble gum was the only option. I crossed my fingers and hoped this would be okay. We went home and I attempted to give my daughter her first dose. Now, this is a kid who takes cherry Tylenol like a champ, but the second that bubblegum amoxicillin reached her tongue, she immediately rejected it. No amount of cajoling or bribery worked. I tried mixing it with cherry juice, and she still wouldn't take it. And this is probably not pharmacist approved, but I even stirred it into chocolate pudding and covered it with sprinkles, and she still would not touch it. My husband and I resorted to holding her down, trying to squeeze it into her cheek pocket with a syringe, but she would scream and cry and gag and choke and spit it out all over herself, all over us. We could not get this medication in her body. So I called 3 different pharmacies to try to get a different flavor, but they all told me the same thing. They only had bubblegum amoxicillin. Choose your own flavor was no longer an option. The 4th pharmacy I tried finally explained to me that there were new guidelines in place that meant only compounding pharmacies could add flavor to medication now. So I called a compounding pharmacy out in Shoreview, and they told me they didn't do amoxicillin. At this point, we had struggled with this medication for several days, and my daughter had taken maybe half of a dose total. I messaged her pediatrician to ask about potentially getting chewable amoxicillin tablets that we could crush into applesauce, something like that, and she suggested just trying a different antibiotic altogether called Ceftonir. So I called the pharmacy again and found out that Ceftonir was strawberry flavored, so we decided to try that. Although my daughter was very distrustful at first after the whole amoxicillin debacle, she bravely tried it, declared it tasted just fine, and finished the course of antibiotics without fuss. But this whole experience was so frustrating to me that I contacted Senator Mann to ask if there was anything we could do about it. Not having different flavors available to my daughter delayed her treatment and cost us time, energy, money, and many tears. I doubt I'm the first parent who has encountered this issue since the flavoring guidelines were changed, and I know I won't be the last. But this bill has the power to make this easier for kids and parents in Minnesota. Taking medication is no fun, but it doesn't have to be a battle. Something as simple as flavor can make all the difference. We should do everything we can to make sure that children will actually take the medications they need to get better. So I urge you to support this bill. Thank you for your time.
Thank you very much. Next we have on Zoom, we have Jason Varon. I apologize if I mispronounce that. If you could please state your name for the record and begin.
Thank you, Madam Chair. You did a fabulous job pronouncing my name. My name is Jason Varon. I'm a doctor of pharmacy and faculty ad honorem at the University of Minnesota, where I've helped educate student pharmacists for 12 years. And before that and during, I've been a professional. My professional identity is community pharmacist, where I've practiced for 30 years. I've also served as president of the Minnesota Pharmacists Association. I'm here to support Senate File 3743, which clarifies the definition of compounding does not include the use of flavoring agent to flavor a drug. As a community pharmacist, my personal and professional responsibility is to provide the best possible health outcomes for my patients. The Minnesota Board of Pharmacy has a very challenging role with their mission statement being largely protecting patients from pharmacy. So when there is an issue like this that falls in a certain definition or category, whether how accurate that is, it's their responsibility to come up with a definition or a documentation process for creating a compound. Now, just as a quick example, if you think of a compound, it usually refers to if a patient has a unique situation where they need two ointments mixed together, like a steroid and an antibiotic. They send the prescription to the pharmacy. The pharmacy needs to compound that per the doctor's orders, which can really change the dynamics or the way that each individual medicine works. In this situation, adding a few drops of inert ingredients, therapeutically inert ingredients, to a prescription is not, in my mind, compounding. Now, as a scientist, I'll say if I was doing quantitative and qualitative studies on a drug or a dosage form, yes, I would want to document everything. But here, as I mentioned, I'm a patient advocate. And being that I want the best possible outcomes for my patients, I want to do what allows them to take it as Krista thank you for testifying, Krista. But I've practiced for 30 years. The primary flavoring agent that has been out for 30 years, I believe. I have been using it I was using it for 25. And it was an incredible change for the ability for me to provide the best possible outcomes for my patients and their parents in many instances. But the way that the newer constraints for pharmacists, the board has worked as hard as it can to come up with what is considered a reasonable way of defining the documentation aspects of flavoring or doing a compound. So they've tried to make it easier, but if you look at I can send you all the information, I'm not going to read through, but there's no less than 7 additional documentation components that must be required to dispense a flavored prescription. And Now I want you to put you in the mindset of you're Krista or another family member that is bringing in the young child. They've been sick, they're miserable, they probably sat in urgent care for an hour or two. The parent's taken time off work or what their responsibilities are. They go into a pharmacy, they present the prescription, they process the prescription, and at the window they have the opportunity to say, well, I can flavor this, but if you want me to flavor it, it may take an additional 10, 15 minutes because I have to do this documentation. Or you can say this will take an additional 2 or 3 minutes to add the flavoring. That is, there's a recipe that is prescribed for each of the components. So this, in Krista's example, flavoring amoxicillin, the manufacturers provide recommendations on 2 or 3 flavors. So you are able to provide that opportunity not only to the parent, but to the child. And just having the ability to choose the yummy flavor that they want is going to really improve the chances of their treatment going effectively and taking it till the end. If they're unable to, besides the difficulties that our previous testifier provided, where you're literally, think of the trauma that provides the patients, having to hold them down and try mixing it with chocolate milk or any of these other opportunities. You create a situation where not only are they not getting the medicine that they should be getting to treat the problem that is being treated. I've seen instances where the child, because they're crying, they're upset, they're vomiting this medication up and they're aspirating it, which includes going to the hospital in some instances because it's such a problem. So I guess what I'm trying to say is, if as a community pharmacist, as a patient advocate, looking at the balance of the potential problems of adding flavoring without all of the proposed documentation or all the board required documentation, removes a big barrier for pharmacists to provide this service. And as I mentioned, the primary flavoring company that's been around for 30 years, their product has been used in over 100 million prescriptions, and there is no record that I could find that there was an allergic reaction or any other issue with that. So I thank you for your time, and I thank Senator Mann for allowing me to contribute to this process, and I'm available for any questions.
Thank you. Members, do you have any questions about the bill? Senator Liskey.
Thank you, Madam Chair. First, Senator Mann, I want to say thank you for bringing this bill. Like the testifiers, I actually have a pretty crazy story related to flavors of medications with my daughter. She was about 2.5 years old, and that was right around the time where COVID was at an all-time high. And we were in the backyard, and she got bit by a bug. We didn't know what it was. She brushed it off after crying, and we just assumed everything was fine. Well, the problem is the next morning we woke up to her eye being almost completely swollen shut. Being a healthcare provider myself, I knew this was an emergent situation, and we called the pediatrician and we did a televisit. Not the best way to diagnose what's going on because she could barely see the swelling on her face, but she prescribed her an antibiotic, which I was pretty sure was what we needed. The problem was when we went to the pharmacy that we were given bubblegum flavored antibiotics. For whatever reason, we've got the idea that kids like bubblegum, and kids that have never had bubblegum definitely don't like bubblegum. So, similar situation. My daughter, we gave her the first dose. She actually took it because she was so sick. She had a really high fever. It was about 102, 103, very lethargic. Nothing, no big deal. Well, she woke up after a nap, and she was doing a little better. Imagine that, the antibiotics were doing something. The problem was that the second dose didn't go so well. She vomited immediately after taking it. That led to more days of fighting and trying to get her to take it. The problem is that her fever started going up from 102. It got higher and higher, and at one point we made it to 106. That was about as scary as you can get. And we called 911 because that's too high. We were rushed to the hospital, and We get there and we find out that she had a high RET count. It was pretty scary. The doctor actually happened to be a pediatrician and said that she was probably hours away from organ failure because her red blood cell count was non-existent. She was just reticulocytes, and that was it. A lot of big words for people that probably don't know what we're talking about, but that's okay. Turns out she actually had an anaplasmosis infection from a tick bite. Pretty severe, pretty scary, but the antibiotic wasn't able to get to her prior to, and it didn't get any improvement because it was bubblegum flavored, and we were told that we couldn't get anything other than bubblegum flavored. So I've actually requested to join you on this bill because it plays a huge role in how kids are being treated for health care, and again, bubblegum flavor is not the flavor that most kids would pick. So I appreciate this and just want to say thank you.
Thank you. Senator Kupec.
Thank you, Madam Chair. Also, thank you for bringing this bill. I will say, as soon as you said the word amoxicillin, I could taste that disgusting taste in my mouth. So thanks for bringing that back to me today. I am tempted to offer an oral amendment to say that whenever possible, guava must be included as a flavoring because we know that's the finest flavor that's out there. But I will refrain.
Thank you. Any other comments? I'm not hearing any. This seems like a very reasonable bill, and it seemed like it's something I wasn't aware that it was that complicated. So I appreciate you bringing it forward, and we can make the lives of parents in Minnesota easier. Any other final thoughts, Senator Mann? No? Then Senate File 3783 will be laid over for for consideration. And next we have Senator Mann has Senate File 4063. And Senator Mann, there is a A1 amendment for this. And would you like to move that as an author's amendment? Senator Mann offers the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail. The amendment is adopted. Senator Mann.
Thank you, Madam Chair. Senate File 4063 is a small bill, really. Makes changes in how the medication repository program deals with medications they can't keep. And it also gives them, with the amendment, more flexibility in how to use their funds. As the program expands, they are the ones who know best how the program works and what they need to be successful. That's it. I'll turn it over to my testifiers, Madam Chair.
And we have Rowan Mahan, or Mann. Welcome to the committee, and please state your name for the record and begin.
Hello, my name is Rowan Mann, and good afternoon, Madam Chairs and members of this committee. Thank you for this opportunity to speak today, and I also want to thank Senator Mann for helping us with Senate File 4015. Once again, my name is Rowan Mann. I'm a pharmacist, and I lead the Minnesota Medication Repository Program, also known as Roundtable RX. Before I go into the legislation, I want to just give a very brief background of what Roundtable RX is and the impact. It's estimated that Minnesota destroys approximately $16 million worth of usable medications each year from long-term care facilities. These medications, though, are often packaged in tamper-proof evident bubble packs, but if a therapy changes, a dose adjustment, any discontinuations, or even if a patient's just hospitalized, those medications in that pack are all just thrown away, even though they're still safe, they're not expired. And then at the same time, as everyone, I'm sure on this committee knows, that many Minnesotans are struggling to afford the medications that they need to live a healthy and happy life. The repository works to address both these problems. Roundtable RX is able to accept these medications that would have been thrown away and have these medications go under a safety check by a licensed pharmacist and then redistribute to individuals in need instead of just throwing these great medications away. This program operates under contract and oversight with the Minnesota Board of Pharmacy. The way that we are able to get these medications out to people we have partnerships with pharmacies and clinics throughout the state. We currently have dispensing partnerships in 26 Minnesota counties, and of those 26, 20 of them are rural. To date, we've served thousands of Minnesotans and redistributed millions of dollars worth of medications to individuals in need. We have kept over 5 million doses out of landfills and the water stream. In our current fiscal year, the program is operating at a 3-to-1 return. So for every dollar that got put into this program, we distributed out $3 of medications to patients that would have not taken those medications. We are kind of a last resort program. And these are also meds that were just going to be thrown away. So a very good ROI at this point. I am here today for two very practical requests. First, a technical administration clarification. Current language requires full destruction documentation even for medications that were never actually accepted into our inventory. We are requesting clarification so destruction record keeping applies only to medications formally accepted into the program. This reduces unnecessary administrative burden and paperwork, and it does not change any safety or oversight. I want to make sure to note that I have reviewed this clarification with the Minnesota Board of Pharmacy, with the Minnesota Pollution Control Agency, and with Hennepin County. Those are the three agencies that regulate pharmaceutical waste, and there are no compliance concerns. Secondly, we are requesting flexibility to use funds that have already been appropriated to Roundtable RX. It is not additional funding, it just is very restricted right now. And we are asking to be able to have broadened flexibility so we can support operation costs to fully deliver medications to patients, specifically cost associated with operating a compliant home delivery pharmacy model. This would improve access for rural and mobility limited patients, increase efficiency of statewide distribution, and support Minnesota pharmacy operations while using resources the legislature has already allocated to us. This is about responsible stewardship, reducing waste, removing unnecessary red tape, and making full use of resources already in the system. Thank you, and I'm happy to answer any questions.
Thank you. Members, do you have any questions? Senator Abler.
Well, thanks. I could just repeat speech number 19 about this project. And for the people, it's just a marvelous effort by, I believe you were students at the time when this came up. So without without lobbyists, with just a really good idea and their own enthusiasm and energy, this program has grown from nothing to, maybe you can just tell me how many, anyway, when I stop talking, you can tell me how many millions or whatever you've delivered to people over the course of your time. But it's really remarkable taking these unused medications, which are a disposal and a trash and a pollution problem, and converting them to a really good thing. So Senator Mann, your project here is evidence that there's something sensible can happen in government, and good things can happen when thoughtful people put their minds to it. So just to commend it, it's I don't know how this is your sixth piece of legislation or something over time, but it's just remarkable. So thank you. So how much have you given away?
We've given
Ms. Rowan, or Ms. Mann.
Thank you, Madam Chair. Senator Abler, we've given over $2 million of medications to patients over the last few years. We really were able to do the last year, the very tail end of 2024 throughout 2025 to where we are now. We've really kind of exploded in our volume of being able to get out high quality meds. We have two things that I'm always trying to think about when we're sending out meds is just number of volume. We sent out over 10,000 30-day supplies in 2025, which is great, but some of those meds are really low cost. But then the way we're able to get our ROI up is we also partner, we have four now, partnerships with specialty and oncology clinics. And now that we're getting out those tinier medication volume, like I'm sending out over 90 a day at this point. That is how we hit those hard ROIs. Like we're sending out a medication this morning that's over 24,000 for one patient that it's a cancer med that they now get to start a month earlier because of our program.
And Madam Chair, I just
Senator
appreciate
Abler.
the clarification and reminding me it's not just money, it's people served and how many, individual, even low cost things. It's just remarkable. So way to go.
Oh, thank you. And Senator Abler was our first chief author, so thank you so much.
Thank you. Senator Bolden.
Thank you, Madam Chair. Thank you, Senator Mann, for bringing this bill. It seems very reasonable changes, and I also just want to chime in to say what an excellent program this is. It is useful and valuable and needed in sort of normal times, and we know we are not in normal times with the, there are thousands of Minnesotans who have lost health care coverage, who will lose health care coverage. And as you said, this is really sort of that, like a safety net program, and without this, people would not get medications. And as you just said, oncology medications for people with cancer. And so I also just want to name, like, this is a fantastic program that is useful and valuable and wonderful, and it is a failure of our healthcare system that that is necessary and needed. People are going without cancer medications, and you all are stepping in to fill that gap, and good on you, and that is wonderful, but we have work to do to be sure that you all are not needed into the future. Thank you.
Thank you. Any other comments, questions? Well, thank you, Senator Mann, for bringing this forward. Thank you for providing us an update on your activities and reasons for needing this. It seems like a great effort as well, and it's amazing how much we can do to try and help more people and, keep this out of our waste stream. So thank you very much. And Senator Mann, any other comments? And therefore, Senate file, and now I put my 4063 as amended is laid over. And I will move to the table, and if Senator Mann can chair.
Whenever you're ready, Madam Chair.
Thank you, Senator Mann. I have Senate File 4015, and this is a bill that was brought forward by the Minnesota Judicial Branch. I do have an A2 amendment that I'd like to offer.
Senator Wiklund moves the A2 amendment, author's amendment. All those in favor signify by saying aye.
Aye.
All those opposed? The amendment is adopted.
Thank you. And this bill has two parts to it that relate to our committee. The first section has to do with clarifying the public authority notice requirements in divorces and legal separations without children. Current statute requires parties in both divorces and legal separations to serve notice on the public authority if either party receives public assistance, whether or not minor children are involved. As a result, parties in cases without minor children are unnecessarily serving county child support agencies, which must then respond to confirm there is no 4D case that the county will not participate in the dissolution or separation. And the Department of Children, Youth, and Families has reviewed this language and does not have concerns. The second part of the bill, sections 2 and 3, has to do with a report that is to be delivered by the Supreme Court Council on Child Protection and Maltreatment Prevention. The due date was going to be January 15th of this year, and last fall, Justice McKay contacted the chairs of the relevant committees to request that we amend the language to extend the date from January 15th to December 15th. Back in 2024, we passed the bill inviting the Chief Justice of the Supreme Court to establish a Minnesota Supreme Court Council on Child Protection and Maltreatment Prevention. And in the first 13 months, the council heard from 30 subject matter experts and held 27 statewide focus groups and collected nearly 1,800 survey responses. The council is requesting additional time to fully review stakeholder feedback and develop thoughtful, evidence-based, and actionable recommendations for the legislature. The council did have an interim report, or an interim report, a progress report, and that was issued in July of last year. And then they will issue a final report with recommendations. And I do have a testifier to be able to convey more information about this I'd like to pass to my testifier.
Welcome to the committee. Please introduce yourself and proceed.
My name is Jeff Shorba. I'm the State Court Administrator for the Minnesota Judicial Branch. Senator Wiklund did an excellent job. We have a policy bill that is moving through the Judiciary Committee, and these two provisions are part of that. But the portions that you just saw need to come through this committee. So I really don't have anything else to add, and maybe Senator Wiklund can come to Judiciary with me this afternoon and help me on my budget presentation. But anyway, thank you very much, Madam Chair.
Thank you, Mr. Shorba. Members' questions? Senator Abler.
Well, thanks. And I don't know much about this, but I thought the author's amendment was a really good one. And so, Senator Wiklund and sir, do you think that that amendment could be carried through into the policy bill that's actually moving and retained, the one about if there's money left over, it just goes to the general fund?
Madam Chair, Senator
Mr.
Abler,
Shorba.
I hope so. We've received pretty positive response from the chairs in both the House and the Senate on this. I don't think this will be overly controversial.
Thank you.
Anybody else? Senator Liskey.
Thank you, Madam Chair. Senator Wiklund, appreciate the amendment. As great minds think alike, I submitted that as an amendment last night too. So I look forward to the improvement, and I do hope that it carries over. I think one thing that the government forgets is that we give money out to try and do these tasks, and the whole point of why we fund those tasks is to have them done. And then on the other end, we forget to recoup that money, and then the money gets lost for a while before a chair like yourself goes and has to find it. So with that being said, I really appreciate the amendment. I don't know much about the bill, but I can understand why it's needed, so thank you.
Anybody else? Senator Wiklund, any closing comments?
No, I think that it was, I appreciated that we heard, last fall that an extension would be helpful to the council that's working on this. We want them to come back with the best, and the most well-developed recommendations that they can, and they will be bringing that report forward prior to the next session starting, and that was really what we needed anyway, so I appreciate being able to make this change. So thank you.
Thank you, Senator. Senator Wiklund moves that Senate File 4015 as amended be recommended to pass and be referred to the Committee on Judiciary and Public Safety. All those in favor signify by saying aye. Aye. All those opposed? The motion prevails. And with that, we are adjourned.
Good luck today.